Good evening, everyone. This is Chris Vanderveen talking to you live from the 9 newsroom, joined by Dr. Kohli, who is going to be a very, very busy member of our staff.
Yes.
You were just on our air. We're going to have a little bit of time. We're going to try to take some questions from you with the new news that has developed, that there are now 2 presumptive cases of COVID-19 in the state of Colorado. As we've been saying for the last hour or so, this is not unexpected.
Not at all.
We talked about this 2 days ago.
We did.
We were expecting this. We didn't know what day it would happen.
Right.
But you're not terribly, this is not unexpected to you.
I'm not shocked. And in fact, the trajectory of what we expect the cases to do is the first few days, just one here or there, and then we'll suddenly get that pickup that we've seen in some of the other states.
So I'm going to start taking, I have to turn that audio or else we're going to get terrible feedback. So if anybody has any questions, now's your time to ask them. I have a load of questions to ask you, so I want to get your sense. But one of the things, so we know that the first presumptive case in the state of Colorado is a patient who is in Summit County, a male in his 30s, traveling with his fiancée, came to the United States via DIA on the 29th, which if I'm doing my math right, is Saturday, correct?
Leap day, yeah.
So what does that, I start wondering about how many people this person had contact with. We know this person had spent time up in Summit County. We know this person was first seen at St. Anthony Summit Medical Center in Frisco, in the Frisco area. Anything that you now expect state health investigators to now do to try to see what interaction this patient might have had with other people in that area?
Yeah, so if you trace back to when you think he was exposed, if we're thinking he was exposed to his friend who's out of state, that was before the 29th. And so he may have been exposed some few days before that. And the incubation period of the virus is 2 to 14 days, with an average of 5 days before you start to show symptoms. And that's exactly kind of
2 to 14 days.
So you
That's a long window.
You can be exposed and potentially be shedding viral particles for 2 to 14 days before you actually start to show symptoms.
That was one thing that the governor said that I think bothered you, was that the governor said, they were on the plane, they were asymptomatic, no symptoms, so we don't have to worry about any of the plane. You don't necessarily agree with that, do you?
Well, I mean, obviously, the level of viral shedding is the highest when you have symptoms. So you're giving off the most viral particles, you're the most infectious. But studies have shown that you can be shedding viral particles potentially before you're infectious. And there have been case reports in the medical literature of people without symptoms also infecting others. So I think we have to be careful. In general, the governor is correct, but we do have to be careful in terms of figuring out who he may have exposed. And thinking about what he was doing up in the mountains in his condo building that he was staying at. Was he pushing the elevator button? Was he, using any public areas?
And we know at least 4 employees of Centura are now going through that protocol of what does that protocol look like, do you think?
So the quarantine protocol is essentially, there's a self-quarantine, as he talked about, or voluntary quarantine, where you kind of isolate yourself and wait for symptoms to develop. You wait out that incubation period of the virus. And then there's a mandatory quarantine where you're ordered to go under quarantine because you may be at risk to others.
We're going to have to get to learn these terms,
Yes.
I think, fairly well.
Yes.
One of the questions I think it's good to go over, Francisco Linares asks, can you break down the symptoms again? I think this is a good time people are going to wonder, what are the specific symptoms
that they should be looking for? Top 3, fever, cough, and shortness of breath. So you can also have other symptoms like headaches, muscle aches. Very rarely, less than 5% of the time, you can have diarrhea, vomiting, gastrointestinal symptoms. But it's really a respiratory illness, so think about lungs, think about shortness of breath, cough, and having a fever.
One of the worst things I think people can do right now is if they have mild symptoms, is to show up at an emergency room.
Yeah.
That's not advisable right now. Because 1, it's just not a good place for you to go to with mild symptoms. And 2, we don't want to start overburdening the system.
You could infect others. So I think the first step is, if you think you may have it, you pick up the phone and call your doctor's office and figure out how you can get a test. At this point, I think the governor also said during his conference today that we're testing more rather than less, which I was very happy to hear, because I think that's a long time coming. So if you're worried you have symptoms, even if they're not typical, or you've had a contact with somebody who may have been exposed or who's traveled to an area that they've been exposed, it's never a bad idea to call your doctor and ask.
We're getting lots of comments about masks. We get that comment a lot. you've talked about this before. Let's talk about it again. What's your feelings on masks?
Masks don't work, but I want to clarify because the governor did say something about masks. He said that they wore a mask. The fiance wore a mask in the car when they came down from the mountain. So typical surgical masks do not work to protect you from the virus. They do work if you have the virus and you want to decrease the transmission to others. So that's the time you wear the mask, is if you yourself are infected with the virus, or you suspect you may be, and you want to go to the emergency room to get it checked out.
A number of people are asking, when did he arrive to DAA? The only thing I heard in that press conference was on the 29th.
February 29th, yeah.
And which is, what?
Saturday. Yeah.
You were at the airport at that time?
I was at the airport, so I'm certainly worried because he didn't really say much information about
we don't know what flight the
what
person
flight
was on,
and exactly. We don't know.
Those are information that we expect to get good. I mean, the state did commit itself. And they were telling us this for days, that when we get this first presumptive case, meaning the state lab is tested positive for COVID-19, that they would try to notify as quickly as possible. And I think that's indicative of what we've seen today. It sounds like the patient was notified just this afternoon that he had tested positive for COVID-19. So this appears to be a system that's working at least efficiently on this end in terms of information. There's talk of what are the standard precautions that people, I mean, we can treat this stupidly or we can treat this effectively. I mean, what in your mind would be effective advice? What are you telling friends right now?
What I'm telling friends is, number one, this is not a surprise. Number two, this is reflecting a change in how we as Coloradans are going to live our lives. So it's not going to be life as usual for us anymore because the virus is here. So we have to be a little more mindful and thoughtful about going to large public gatherings, traveling when it's not necessary, doing a lot of the things that we as Americans and Coloradans take for granted. Until this virus gets better contained, we better get a hold on what's going on. At the same time, I think you should empower yourself and be prepared because you're part of the spread of this virus. And that's the other message I want to send, is that you're not a passive victim. Your behaviors will influence what happens to this virus now that it's here.
If ever there was a situation where we're all in this together, we're kind
this
of all
is
in this
it.
together, right?
This is absolutely it, yeah.
Zach, Tish, I have a vacation in Frisco next weekend. Is that safe? I don't want to speak for you. You can answer this. I hope people don't stop making drastic decisions based on one or two presumptive cases that are expected.
Right. I agree. And I think whenever somebody asks me the vacation question, I say who, why, and where. Who's going? If you're young and healthy, probably okay. Why are you going? Recreation, meeting, business, and then where? And Frisco, yes, this case was in Summit County, but it's not one of those epicenters that we're seeing in Asia or Europe right now.
Yeah, Brittany just asked, I have a trip planned for the end of the month. Should I cancel? Same kind of thing.
Yes.
That's the whole thing.
Yeah.
School questions. We're going to get more of those. I see one right there from Elaine.
Yeah.
I'm a parent.
Yeah.
I have questions. What do you think schools should start be thinking about now that the virus is at least unofficially here, but it seems by all indications that the virus is certainly here, pending a CDC test, but we've already got 2 positive tests in the state of Colorado?
I think a lot of schools around the world have closed, New Delhi, Italy, and it's really disrupting education and all of that. So given the circumstance we have today, it is not time to start closing schools or thinking about keeping kids at home because of this virus. Now, things could obviously change very quickly in the next few weeks, but at this time, I don't want parents to panic or feel like they have to keep their kids out of school because, as we've talked about before as well, we're noticing that the rate of infection in kids is relatively low. Now, it doesn't mean that they can't get it at all, but at least what we've observed from the data in Asia is that there's less than 1% chance that kids will get this virus.
How can we, Shaylin London asks, how can we build our immunity?
I wish I had a magic pill to offer to build immunity, but I think at this point the best thing that you can do is make sure that you're not drinking too much alcohol, getting enough rest, staying hydrated, eating a well-balanced diet, and then doing all those hand hygiene things that we talked about, because all of that over time helps. If you haven't gotten your flu shot, that's going to build your immunity, not against the coronavirus, but against the flu virus, which is...
What I think is interesting about coronavirus is that we don't really we don't have anything that can defeat it. There is no vaccine. There's nothing there. But it is the worry of the secondary infections that really is the treatment protocol, that you can treat those secondary infections and that's what people can potentially die from.
Yeah, well, there's two ways to die from the coronavirus. One is to actually have just complications, immune complications from the coronavirus itself, leading to multi-system shock. And the second, Chris, is exactly what you said, which is you could get a coronavirus infection, which could distract your immune system, so to speak, and then you get a secondary infection like a pneumonia or the flu or something else, and then the combination together can overwhelm your immune system. So,
Elizabeth, are pregnant people more at risk?
So we don't have a lot of data on pregnant women. We don't know if they're more at risk, but we have a case study of 9 pregnant women that were studied, and a few of them had the same symptoms that normal adults have, as some had more serious lung symptoms, but all of them ended up delivering healthy babies, and none of the babies actually had coronavirus infection.
There's some Purell. I can't buy Purell anywhere. I think what's interesting, I suspect that the news of the day is probably going to make people even do more shopping.
More shopping, yes. I suspect that too.
I mean, again, with this mentality that we're all in this together,
right?
What's some good? I mean, should people be stockpiling Purell? Should people? I mean, I've seen cold medicines that are tough to get.
Yeah.
What's good common sense advice that we don't carry this too far?
So, I mean, I think don't run out and go crazy looking for Purell, because you can still wash your hands with soap and water. That's always an alternative. And it's not a time to start stockpiling these types of supplies yet. Now, in the next few weeks, again, the situation could change. At this point, I would recommend you go to the pharmacy and get a 30 to 60 day supply of your prescription medications, because you don't want interruption in those. And the FDA has said there's about 20 medications that come directly sourced from China. And at this point, they're not anticipating a shortage, but they have advised people to make sure that if they take prescription medications, that they have a good supply of those.
We get a lot of comments about the flu, and certainly you've talked about this a lot. I looked up the statistics right before we went on live, and talking about, I think there's something like 3,000 hospitalizations in the state of Colorado due to influenza. There have been 3 pediatric deaths so far in the state of Colorado. This has been a tough year for pediatric deaths in influenza in the United States, although the total deaths is down a little bit, but the pediatric deaths
is
are
higher.
up.
Yeah.
Certainly flu is one of those things that people glom onto and say, well, flu is worse, and right now it is worse. But we know a lot about the flu.
Yes.
There's still a lot of unknowns about this, and that's probably the issue, is it not?
That's exactly the issue. That's exactly the issue. In fact, the symptoms of the flu in most adults are probably more severe even, so it's not just that it has worse outcomes, but it's also more severe symptoms. But I think it's the unknown. It's the fact that it's a new virus, so none of us have immunity to it at this time, which is what is one of the things that makes it spread so fast. Whereas with the flu, we've had it every year. We've all had the flu. We've all developed the immunity to it. So the spread or the rate at which it gets around is not as high. So an average person who gets the flu will spread it to maybe one other person, whereas with the COVID-19, you'll spread it to 2.2 other people if you contract it.
People with asthma, reactive airways more at risk? I think the answer to that is
yes, because it's a lung disease.
And are those those are the people, like maybe for those folks traveling?
Think about it. Yeah. Think hard. Is risk benefit everything in life? You need to own your health, because it's not a uniform message for everyone. So it's the who, the why, and the where. And if you've got asthma and you're going somewhere where there's a lot of coronavirus right now, and it's not a good reason to go, I would say don't go.
Kelly Watts puts in quotes presumptive, and I think that's important. We want to sort of talk about presumptive. You're going to hear it a lot in the news tonight. What does presumptive mean? Presumptive simply means the state has tested it and the state result has come back positive.
Correct.
It means something.
Correct.
But in order for it to be final, CDC
has to confirm the result. Exactly.
And so the CDC will then confirm, assuming that, and if it's not, they'll tell us. But the state has always said, when we get a presumptive case, we're going to act as if it's 100% correct. And that's just being responsible, is it not?
That's the right thing to do, yes.
Okay. I think we're getting ready for our 6 o'clock newscast. So again, we have been trying to do this on a fairly regular basis. We're going to try to continue to do that. We are going to tax Dr. Kohli to the utmost of her abilities, but this is why you're here.
That's why I'm here.
We're so glad that you're here.
I'm glad too.
And if people have questions, they can always, we're going to try to keep this, we kind of gone back and forth on what times we're going to keep this. I want to keep it to a consistent time. We felt the need to do this now because of the news from the governor. I think the most important things that we heard from the governor are 2 presumptive cases.
Yep.
We know more about the person who was in Summit County than we knew before. We knew the person is now being treated in the metro area in Jefferson County. We don't know. We know very little about the second case. What would you like to know about that second case?
I would like to know, are they elderly? Are they immunocompromised? How they got it? What their contacts were? So we can start to prepare.
Do you think in the coming days we're just going to see a drip, drip, drip on more cases, or do you think we're going to see a lot more?
I think from what we've seen in the other states, drip, 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 5, 7, 10, and then lots of cases. So there's a slow increase, and then you kind of have a steeper slope, I think.
I would think facilities that have high, we've seen this in Seattle, we've seen this in Kirkland, facilities that have high-risk patients.
Nursing homes.
In close quarters.
Yep.
This is something
Retirement
that absolutely
villages.
need to be paying attention to right now.
100% accurate, yeah.
Thanks so much, Dr. Kohli.
Thank you.
We'll be back as the days and the news warrant, but thanks so much for joining us. We really appreciate it, and your very intelligent questions.